Ladies and gentlemen, NFID, colleagues, friends, family, I'm deeply honored to receive this award and humbled by the list of previous recipients and their accomplishments. In the early 1970s, I met Max Finland on multiple occasions at annual meetings of the Infectious Diseases Society of America and at the spring clinical meetings in Atlantic City. An icon of infectious disease research and clinical care for decades, Maxwell Finland was a member of the National Academy of Sciences and the first president of the Infectious Disease Society of America. Nobel laureate Fred Robbins wrote a biographical memoir about Max Finland on behalf of the National Academy following Max Finland's death. Fred Robbins pointed out that Max Finland was an immigrant from the Ukraine who came to Boston in 1906 at the age of 4 years. He attended Boston English High School, graduated second in his class, and earned a scholarship to Harvard College. Thereafter, he attended Harvard Medical School and did clinical training in the Harvard service of the Boston City Hospital. Fred Robbins states that Max Finland originally intended to enter private practice, but became so enthralled with academic infectious disease research that this became his calling. Max Finland bridged 3 historic eras of infectious diseases, including the pre-antibiotic era of the 1920s and 30s, the early antibiotic era of sulfonamides and penicillin in the 1940s, and the era of the 1950s, 60s, and 70s, when many new antibiotics appeared, and as we heard, many were followed by emerging resistance. In recent months, from some quarters just a few miles from here, we've heard much acrimony about immigration and immigrants. Let us remember that Maxwell Finland, a consummate American hero, was an immigrant. In accepting this honor, I must acknowledge many individuals. First and foremost, my wife, Suzanne, who has been my partner on an extraordinary life journey that includes 51 years of marriage. Our union has generated 3 wonderful human beings. You've just seen one in action. Our children, Oren, Rachel, and Rebecca, who are at table 1. And in turn, they and their spouses have blessed us with 8 stunning, bright, and inquisitive grandchildren, and you've seen their picture a moment ago. I must also thank 2 executive assistants, Christine Suver and Dottie Small, who are like family and who supported me for 3 decades. And I can tell you very honestly that my career would have been very different without these 2 individuals taking care of me and keeping me on the straight and narrow. I believe that luck and fate play important roles in lives and careers. This was certainly true for me. I entered university at the tender age of 15 years and began medical school at 19 years of age. I was a kid, but I brimmed with the innocence and optimism of youth, which allowed me to dream some unlikely dreams. Interested in tropical medicine and tropical pediatrics since my college days, and with a penchant for microbiology and immunology, I envisioned myself working on health problems in developing countries. Bear in mind that in the early 1960s, there were few vaccines given anywhere to anyone, and few independent countries in Africa and Southeast Asia. President John F. Kennedy established the Peace Corps in 1961, and had I not been accepted to medical school in 1963, my primary backup plan was to enter the Peace Corps. Truth is, I never set out to be a researcher per se, but that's what came to pass. Throughout the different stages of my career, I had the fortune to to have exceptional mentors to guide me. These include John B. Robbins, in whose lab I worked as a pediatric ID fellow in late 1969 and the first half of 1970 at the Albert Einstein College of Medicine in Bronx, New York. Dick Hornick and Ted Woodward and Bert DuPont at the University of Maryland. All three of those individuals later served as presidents of the Infectious Diseases Society. Also at Maryland, David F. Clyde, famed malariologist. Eugene Gangarosa and Phil Brockman were my field epidemiology mentors at CDC. David Mell of the Military Medical Institute in Belgrade, Yugoslavia at the time, was a collaborator with Gene Gangarosa and myself on early Shigella vaccines, and David was a mentor to both Gene and myself. Leonard Bruce Quat and Donald Mackay at the London School of Hygiene and Tropical Medicine were my mentors there. D.A. Henderson, who headed the smallpox eradication program and later became the dean of the School of Hygiene at Johns Hopkins, was a mentor and counselor for multiple decades. Samuel B. Formal at the Walter Reed Army Institute of Research was my mentor on Shigella pathogenesis and Shigella vaccines, and he was also a mentor to two other Maxwell Finland Award recipients, Stanley Falcow and Bert DuPont. And lastly, Major General Phil Russell, since the 1980s, has repetitively been a counselor and guide and mentor. I accept this award on behalf of the faculty, fellows, and students of the Center for Vaccine Development, who over 43 years were partners, who helped to forge a new discipline, vaccinology, and who contributed to making CVD a model academic vaccine development enterprise. Many folks from CVD from years ago and currently are at three tables on this side, colleagues and alumni, and I salute each and every one of you, and you have my heartfelt thanks for being here. In 2015, I passed the baton to Kathy Newsel and Chris Plow. Kathy as the new director of the CVD, and Chris as the founding director of the nascent Institute of Global Health. The University of Maryland is extremely fortunate to have these dynamic and visionary leaders for the years to come. Ladies and gentlemen, once again, I thank you for this great honor.